Several reports from across the country of people misbehaving with healthcare workers and doctors over apprehensions that these frontline workers were carrying the disease and could infect others. And in light of the government's decisions to put out all stops to protect such healthcare workers, in focus tonight is government for zero tolerance on attacks on healthcare workers. To talk about that, we have with us Dr. Vikram Singh, former DGP, who is joining us on Skype. Also, Dr. V.K. Paul, member Niti Aayog, is with us in the studio, and Praful Ketkar, senior journalist, is also with us. Dr. Paul, I'll begin with you. Does the decision of the government to promulgate an ordinance that provides for stringent punishment for perpetrators of attacks on medical professionals who are discharging their duties during the outbreak of this pandemic show government's resolve, and was this necessary, considering that some of us are refusing to acknowledge the human service that is being rendered by health professionals across the country in these tough times? They're refusing to acknowledge that they are putting their own lives at risk to save our lives.
Well, I think the situation coming from the instances that you showed and several others was emerging to be very disturbing to the whole psyche of our nation. And what the government has done is what the nation as such believes, that our frontline health workers, our doctors and nurses had to be protected. They are serving in very challenging situation, risking their lives, and they are fulfilling their duty to save the nation and its people. It is very important that a timely message was to be sent at this point in time, because we have tried to work by promoting respect for our healthcare workers. The Honorable Prime Minister took the lead in giving respect and dignity and celebrating their achievements.
He simply said that there will be no compromise.
Absolutely.
As far as the protection of healthcare workers are concerned, he said that each and every healthcare worker who is committed to their duty, who is discharging their duties at this point in time, protecting them is the top priority of the government.
So the nation, you know, in a stark respect for the profession, on April 22nd, celebrated the achievements and expressed gratitude. But these elements, however few they are, have created an atmosphere where the health professionals are feeling threatened, their sentiments are hurt, their families are worried, and it was time that a very strict and clear cut message goes that there is zero tolerance on the part of the government as well as part of the society as a whole to such incident. This is totally not acceptable, because it hits the morale of workers, health workers and doctors and nurses, and this is not acceptable as a nation's fight at this stage to take care of this pandemic that we are facing at these challenging times.
Praful Ketkar, while the government has taken a tough action via this ordinance, it has shown zero tolerance with regard to such attacks. But what is wrong with us as a society when we look at the behavior of some elements who have stooped to the level of denying basic dignity in death to a doctor who died while discharging his duty, who spent the last few minutes of his life treating a COVID-19 patient and was infected in the process? That doctor was denied burial in Tamil Nadu.
See, I have actually enlisted this. There are 27 reported cases of either discrimination or open violence against the health workers in last few days, and in most of these cases there are we can broadly categorize them in two parts. One is about which you were talking about, this fear psychosis about health workers being the carriers of corona infection. These incidences are very few, but they are also important. They should be dealt with very effectively, especially in cases of nurses and ASHA workers, because for doctors there were certain issues related to their residential area, but we have more positive stories about where doctors are staying, where their entire society or entire colonies are taking care of their family members, standing by them, and supporting them.
But as far as ASHA workers are concerned, look at the incident that came to light
That's
in Nagpur.
unfortunate, you know,
that
in
they were
Nagpur, not
beaten.
just in Nagpur, even near Bangalore, what kind of, you know, attack that has taken place. This particular thing is basically part of rumor mongering, religious, sectarian, fundamentalist thinking, and I am very blunt on this. I know I am very responsible, you know, and very responsibly making this statement, because out of these, you know, violent attacks, most of them are taking place in particular locality where some kind of, you know, this Tablighi Jamaat linkages were there. Some people were either hiding or they were spreading these rumors that ASHA workers or health workers or police machinery, and now even Arogya Setu is being used to map, you know, collecting data, and you know, it is linked to CA, it is linked to NRC, everything. So there is a lot of rumor mongering going on, and as part of this, these attacks are taking place. So we have to deal with this on the one hand at the sensitization level, but on the other hand at the legal mechanism, and that's why this promulgation of ordinance was necessary. On the one hand, this was a very old act, 1897, immediately after the plague epidemic in especially in Kolkata and other parts of you know, Pune, important areas that had taken place. British had brought this mainly to, you know, regulate the mechanism in the plague kind of situation, but this you know, amendment now will enable the government to ensure safety and security of health workers.
Absolutely.
The non-bailable offences are identified, and the corresponding, you know, punishment is also specified.
Yes.
So I think this is a major departure from 1897 Act. So we have to see this, why this was necessary, because some irresponsible, superstitious, fundamentalist elements are taking laws in their hand, and instead of cooperating with the health workers, attacking on them.
Absolutely. Dr. Singh, there are stringent provisions that are there in the ordinance that is being promulgated by the government. The cabinet has given its note to it. Will there be deterrence effect of these stringent provisions? And they are quite stringent if you look at the jail term, the fine term and the compensation provisions.
I have no doubt in my mind that they will have far-reaching positive consequences, in the sense that you, in your opening remarks, you very clearly mentioned that there are provisions in the IPC 269, 270. There is provision in the Criminal Procedure Code section 188 and 151. There is also provision in the National Security Act. But the present amendments are most welcome. They are contemporary and relevant, and seldom have I seen this swift professional response to a calamity. Here you have enhanced jail sentence, you also have enhanced fines, but the more important than what did not happen earlier on any occasion, including Nirvaya, that the investigation would be completed in 30 days. Fast track courts will decide the matter in 12 months, and punishment will be ensured. And therefore, I see that this is a very, very welcome step for those who attack our guardian angels, our paramedical staff, our doctors, and it is a clear, unambiguous message to one and all that the teeth has been added to the 1897 Prevention of Epidemic Diseases Act, and therefore a clear signal. You also showed in your opening remarks that the doctor from Moradabad, the injured doctor, and other doctors and paramedicals have very, very openly welcomed the changes made, because this will safeguard and give a security cover to our staff and people who are on the roads protecting us and our loved ones.
And was it absolutely necessary to make this offence non-bailable, which the government has done through this ordinance?
Absolutely not. It was very imperative, because in the earlier cases, all the cases were bailable, and bail is a matter of right because of the various judgments from High Courts and the Supreme Court. Making it non-bailable will ensure that those who take law in their own hands, as Mr. Ketkar had mentioned, the lumpen elements, the irresponsible elements of society, a clear, unmistakable indication and indication that one would be behind bars, and it may extension, and the prison sentence can go right up to 7 years.
Absolutely. Well, Dr. Paul, are there clear guidelines and protocols with the centre as well as states and maybe even at the panchayat level on the precautions that need to be taken during burial or cremation of people, because there is a lot of misinformation, as Praful Ketkar was saying, that at the heart of this is a misinformation campaign which is fueling paranoia. So if there is a misinformation campaign, then what needs to be underlined here is that there are protocols and some precautions, if you could tell us, that need to be taken at the time of burial and at the time of cremation, so that basic dignity in death is not denied.
Yes, these guidelines are available now. They have been recently announced, and they are available on the Ministry of Health website. There are precautions to be taken in these instances. These precautions need to be followed, and they must be carefully implemented on the ground. But having said that, there is no case at all for the kind of undignified behavior that has been witnessed in some instances where burial has been denied, burial has been delayed, and violence has been incited in a very solemn point of the situation that emerged, for example, in Tamil Nadu and also in Meghalaya. This is not acceptable to civilized society, this is not acceptable to the government, and therefore a very clear message needed to be sent, and this has now happened. And as the speaker, previous speaker said, yes, this will send the right message that it is not acceptable, and it will energize and reassure the health workers and their families that the nation is with them.
Praful Ketkar, how can this misinformation campaign, the nexus that we are seeing, be broken? Can it be done through greater publicity of what are the precautions and the kind of action that would be taken against such perpetrators? What should be done to break this cycle?
See, I think there has to be a multi-pronged approach. On the one hand, there has to be sensitization, which we have been doing. Unfortunately, our government, Prime Minister and everybody is in the forefront. They knew that we will need this kind of psychological preparation. That's why we saw on Janata Curfew Day on 22nd March, thousands of people, millions of people came out on their terrace, on their doors, and actually thank these Corona warriors. Secondly, what we have seen now in terms of action, but there has to be some kind of legal deterrent to perpetrators of crime, and these are crime against humanity. So we have to deal with it as a crime. But at the same time, I think we need another approach addition to this. Is actually community leadership coming forward and talking to people, standing by the Corona warriors and sensitizing common people. Instead of allowing common people to be governed and psychologically handled by some fundamentalist elements, if some community leaders come forward, they are taken together and they play a constructive role in mobilizing the public opinion in favor of Corona warriors, then it will be much more useful. A deterrent has to be there, but simultaneously this participatory approach should be created so that there is no misnomer, there is no rumor mongering, there is no fear psychosis around use of any technology, medical science, or the survey methods that are being used in this particular exercise. This has nothing to do with collecting data, this has nothing to do with NRC, this has nothing to do with identifying some community either for isolation or taking certain political action. It is a pure medical exercise for the national cause, for the humanitarian cause, and it has to be told by the community leaders. You and me or anybody from the government side just telling this is not going to help, because it is told by some religious fanatic leadership, and it has gone down much below, as we have seen in the Indore incident. So we have to create religious and community leaders who will communicate with the larger masses.
Absolutely, you're
and
saying community leaders, yes, should come forward and take matters in their hands. Yes,
positive
please.
Stories must be brought out, because these are few elements who are doing these stupid things, but the entire citizenry of our nation, all the people are so grateful to the corona warriors, and the positive stories of how these are being nurtured and respected and extended the courtesies have also to be brought out, and
Absolutely.
I think that
DD
is where
News
the
is bringing out
responsibility
these
of all of
stories.
us lies.
Absolutely. DD News is in fact bringing out these stories of corona warriors, the hardships that they are facing while rendering human service to the country, and it's really unfortunate that some sections of society have actually resorted to attacks on such people who have risen over a lot of things to discharge their duties in these tough times. Well, Dr. Singh, the Home Ministry has written to states and union territories once again and reminded that there were 3 communications that were there in the past as well, dated 24th March, 4th April, 11th April, and also the Supreme Court order of 8th April 2020, which says that security needs to be provided to healthcare professionals in order to prevent such instances of violence, and these need to be provided at hospitals at the time when they go for screening, or at places where suspected cases or positive cases are housed, where healthcare professionals need to go. Why do you think these instances are taking place and states and union territory administrations are unable to prevent it? From your perspective, as someone who's been a veteran in the police forces, what would you say?
It's bad enough that the central government and the Honorable Court have to order on issues that are the very basic duties of the law enforcement agencies and the police department. And it is worse still that in spite of these orders, one has failed the society by not doing what they are expected and paid to do to protect the doctors and the paramedical staff. I would have been very satisfied if these orders were complied with in letter and spirit, but the fact remains that there is a lot that needs to be done and miles to go before we sleep. We have to put our act together, have a no nonsense and zero tolerance, as the Prime Minister has said, in respect of the attack and assault on our doctors and paramedical staff. But there has to be an SOP. The SOP is very much there. The internal security scheme is very much there. But the drill are also there. But there has to be on the topmost priority on the agenda and the scheme of things of the police and the district administration. Obviously, it was not on the top of the agenda. That is why the reinforcement and the reminders came from the central government and also from the honorable courts. I do hope that we give our undivided attention and the topmost priority to these instructions, and let us hope that this, I don't say it can bring, but I do hope that it brings an end to the assault on our doctors and the paramedical staff. And about one small point in respect of fake news, deep fake news and WhatsApp disinformation. There is a system also to contain that, and also community outreach and community policing experiment and policing by consent.
Absolutely. Those are extremely important points that you are highlighting. Dr. Paul, another decision that was taken and which Union Minister Prakash Javadekar spoke about was on Ayushman Bharat beneficiaries. He said that more than 50 crore Ayushman Bharat beneficiaries can get their treatment as well as testing facilities for free, even in COVID-19 hospitals that are not impaneled. How important this is, considering that Ayushman Bharat beneficiaries are the poorest of the poor in India?
This was much awaited decision because in principle, the beneficiaries of Pradhan Mantri Jan Arogya Yojana Ayushman Bharat are entitled to hospitalization at secondary and tertiary level in empaneled hospitals, whether they belong to the government system or the private system. Once they are empaneled, they should be providing services to the beneficiaries, and therefore this clarification and this clear-cut decision goes in the right direction, and it is a security to the poorest and the most vulnerable people of India that look, the entire health system as one health system is available to you, and this is an extension of your rights. It was embedded in your rights as the beneficiaries of PMJ, and I very, very warmly welcome this decision.
Absolutely. And towards the end, the least that we can say at this point in time is that the society should value the selfless service of corona warriors in these tough times. The least that we can do is to make them feel valued, protected and safe, considering that they are working day in and day out, keeping their own safety concerns aside in order to ensure that you and me don't lose our lives in this battle against COVID-19. Well, thank you for having joined us, Dr. Paul, Dr. Singh, as well as Praful Ketkar on Newsnight tonight.